Hi, everyone. Sorry for the wait. We were just waiting for some additional attendees to join in. But let's begin again. Good evening, everyone. A very warm welcome to all of you guys, our esteemed guests, our colleagues, and all the healthcare professionals joining us today. We're truly excited to have you here for the launch of Clinix iNutriMon, a step forward in transforming how we deliver nutrition care. So, before we begin, let's just take a moment to appreciate how far clinical nutrition has come and how technology is helping us move even further. Today, you'll get to see how Clinix isn't just another tool, but a complete digital partner that's been designed to help you in your daily practice. So, let's just get started. The idea behind today's session is to introduce a smarter, simpler, and an integrated way to manage the nutrition care process that is built by dietitians for dietitians. We've designed this session to be an interactive one. So do stay with us for the polls, the live demos, and an engaging panel on the future of clinical nutrition. We've talked about the idea behind today's session. Now it's time to hear from the person who made this vision a reality, leading with passion, purpose, and a clear focus on impact. Hans has guided DocMode towards redefining digital healthcare. Let's give him a warm welcome to our CEO, Hans Lewis, as he shares the vision behind Clinix iNutriMon.
Thank you, Ronak. Good morning, everyone. Good afternoon, in fact. 6 years ago, Dr. Sanjeet Sashidharan, Head of Critical Care, SL Reja Fortis, and current past president of his pen, came to us with a challenge that would change everything. He shared the daily struggles dietitians and physicians face in delivering scientific, trackable nutrition care. He asked us a simple question: can technology make nutrition care better? Today, as we launch Clinix iNutriMon, I'm honored to say we didn't just answer that question. Together, we revolutionized it. I want to thank my co-founder, Paulson Paul, whose vision and unwavering belief in transforming healthcare made this possible, and to our incredible iNutriMon team, Vivek, our lead dietitian Prachi, Yogesh, Nikita, and Akib. Your dedication turned this vision into reality. And thanks to our internal DocMode team for setting this virtual launch. But here's what I've learned most profoundly. Great innovation doesn't happen in isolation. It happens in community. The dietetics community here didn't just support us, you shaped us. You involved us in your daily challenges, gave us honest feedback, and pushed us to think bigger. You gave us the grit to keep refining and improving. Every hospital dietitian who shared their workflow, every practitioner who tested our platform, you built this with us. To the 25 partner hospitals that trusted us, thank you for your faith. Your validation gave us credibility. Your results gave us proof. Over 1 million patients have benefited, and 6 publications have documented our impact. To the professional societies, ISPEN, IAPN, and ISCCM, thank you for providing platforms to showcase our work and for validating our concepts scientifically. Your endorsements and accreditations mean everything. We started with a simple concept. Today, we have a patented, award winning platform that transformed hospital nutrition care. But as we engaged with the community, a clear message emerged. Independent practice needs this too. That's why Clinix iNutriMon exists. Our vision has always been to build an ecosystem, a connected world where every nutrition profession, whether in a 500-bed hospital or a solo clinic or in a wellness center, has access to world-class tools, where every patient receives evidence-based, trackable, measurable care, where nutrition takes its rightful place as a cornerstone of healthcare. Clinix iNutriMon is designed specially for dietitians and physicians running clinics and building practices. You told us documentation takes 45 minutes per patient. You told us paper records are limiting your growth. You told us you can't demonstrate outcomes systematically. We listened. Clinix iNutriMon solves this. 3-minute nutrition prescriptions, automated compliance tracking, complete patient histories at your fingertip, scientific documentations, tools that let you demonstrate measurable results and position your practice as an outcome driven nutrition care center, not just a one time advice provider. Before I conclude, I want to express our deepest gratitude to our distinguished speakers today, to our keynote speakers, Dr. Zamrud Patel, the head dietitian at Gleneagles Mumbai, and Dr. Mansi Patil, National Executive Committee, IAPN. Also, I want to thank all our distinguished guests and keynote speakers and panelists, Dr. Amreen from KIMS, Ms. Rutu Dodapakar, Mr. Anam, Miss Anam, Miss Aarti, Miss Nisha from SVT, those who couldn't make it, and thank you for lending your expertise and credibility to this launch. Your insights and leadership in the nutrition community inspire us all. To our esteemed panelists joining us today, your participation validates the importance of this mission and it enriches our collective understanding of how technology can transform nutrition care. And once again to Dr. Sanjeet Sashidharan, not just being a catalyst 6 years ago and championing throughout this journey. Thank you for believing in this vision from day one. As we launch today with our free 3-month offer till December 31st, I want to leave you with this. Every patient deserves the best care. Every dietitian deserves tools that amplify their expertise. And every clinic deserves to thrive clinically and financially. Clinix iNutriMon makes all of this possible. To everyone who's been part of this journey, thank you. You didn't just support a software company, you supported a movement to make nutrition care smarter, more scientific, and more impactful. And to those joining us today, welcome to the ecosystem. Welcome to the future of nutrition care. So go out there, refer and urge Clinics and Nutrimon to all your colleagues, friends in the nutrition space to register in this limited time that we have. Register now. The link is shared in the chat. Let's continue transforming lives together. Thank you.
Thank you, Hans, for that inspiring vision and towards everyone that's been a very key part in contributing towards building iNutriMon, Clinics iNutriMon. It's really exciting to see how Clinics iNutriMon is shaping the future of digital nutrition care. Now, let's continue the momentum as we move into our expert session. It is my pleasure to introduce Ms. Chinmay Save, who is an accomplished dietitian and a medical writer with deep expertise in clinical nutrition. She will now lead us into an interactive session, offering valuable perspectives drawn from her extensive hands-on experience in patient care.
Thank you, Ronak, for this introduction. Hello, everyone. Good evening. It's great to have you all here today. Before we move ahead, we'd love to hear from all of you. You will see a quick poll appearing on your screen. Please take a moment to vote. It will help us to understand what matters most to you as clinicians. The question is, what is your biggest challenge in day to day nutrition practice? Hello, is everyone able to answer the question? Thank you for sharing. It's heartening to see that many of us are facing similar hurdles, and that is exactly why the Clinix is designed. Moving forward, I would like to invite a seasoned expert who has been shaping patient centered nutrition programs for over a decade. Please welcome Ms. Prachi Villar. She is a registered dietitian and a certified diabetes educator with more than 12 years of experience in a field of nutrition. As the head dietitian at DocMode, she is passionate about advancing clinical nutrition and supporting better health outcome through education and innovation. Welcome, Prachi.
Yeah. Good evening, everyone. Thank you so much for the introduction, Chinmay. We are honored to have with us today our esteemed keynote speakers whose presence adds great value to this occasion. Your guidance, support, and expertise inspire us and motivate us to strive for excellence in clinical nutrition and healthcare innovations. Now, let's move on to our keynote segment where some of the most respected voices in clinical nutrition will share their thoughts on how technology and evidence based practice are shaping the next decade of nutrition care. Let's join together to welcome our esteemed keynote speaker, Zamrud Ma'am. It is my pleasure to welcome Ms. Zamrud Ma'am, Head of Department and Chief Dietitian at Gleneagles Hospital, Mumbai. She is a registered dietitian and convener of the IDA Mumbai chapter with remarkable work in clinical and renal nutrition. She is also one of the author of the FSSI Purple Book and has been recognized nationally for her outstanding contribution to the field. We are grateful to Zamrud ma'am for her invaluable support and guidance throughout our journey with iNutriMon. As a current user of our platform, her insights have been instrumental in helping us refine and enhance our solution. We are truly honored to have her with us today to share her keynote on technology and nutrition practice. Welcome, Zamrud.
Thank you, Prachi, for those kind words. Indeed, I'm very happy to be here because this is one field that I have been working very in clinical nutrition. Initially, when I started my practice. What I used to use was Excel to save my data and make my diet plans in Word. But when Prachi presented this DocMode platform and this iNutriMon software for the hospital, I was really very happy because as a nutritionist, we all follow the nutritional care process, and when we follow the nutritional care process, we need to use a lot of tools, our formulas, our tools. When I say we are talking of SDA, MIS, so when you have to do your assessments, this I think this platform is really something which is very good. I have been using this in my practice when it comes to the IP patients, and that is the time I think I and Prachi were discussing, and this concept also she discussed with me, that how it can brought to the OPD also. I think this is one of the most useful platforms for a clinical nutritionist who would be, it will be really helpful. It's not only helpful in your day to day work, it will also help us to have the flow of our patients visits with us, how they have performed, how they have done. So you can record all the details, all your patient data can be stored very well, and you can actually do some of the research work. In fact, Prachi has been telling us that what more we can be doing, and Hans has been very helpful to me. I should not forget Vivek, who has helped me in the time of crisis when there was some issues, technical issues. So I think this team is also very good, and the technical platform that they have generated for nutritionists is something that is really very good. As a nutrition, I think for our nutrition care process, for our assessments, for our diet planning, they have generated a very good platform, and I look forward of using this. So best wishes to the team. Thank you.
Thank you, Zamrud ma'am. That was such an inspiring message to all of us. Thank you so much for sharing your valuable thoughts and experience with us. Now let's introduce our next keynote speaker, Dr. Mansi Patil. She is a renowned nutrition consultant and expert in hypertension management. She is a part of National Executive Committee of IAP in India and serves on International Committee for Hypertension and Cardiovascular Health. She is passionate about improving care in low resource communities. Dr. Mansi also teaches at Victoria University, Australia. She is shaping the next generation of healthcare leaders. Over to you, Dr. Mansi.
Thank you, Prachi, for having me here. And I think Zamrud ma'am has beautifully said why we need this tool today and why we are here. So for me, I've been practicing for over 15, 20 years, and it's primarily outpatient setup that I work in. But over the years, I've seen that the patient care has evolved dramatically, and digitalization has been a major game changer. With these digital tools that we have, we can now access patient histories, lab reports, dietary records, even the guidelines that are there. Now, this does help us in personalizing the nutrition plans more accurately, and we are able to more closely monitor the patient progress. And it's a much more consistent monitoring that we are able to give to the patient. This basically reduces the errors which did happen with manual records, and we are able to ensure that the patient gets a more safer and an evidence-based guidance every time that they visit us. Documentation basically, honestly, documentation was haphazard, and that has become far more streamlined and organized. And instead of shifting through piles of papers and files, we can now update these patient notes in real time, track their progress over months and years, and even share the information very securely with other healthcare professionals. Now, this not only saves times, but it ensures that there's a continuity of care, the nutrition care process that we are talking about. And you know uh, the cross consultation also becomes much more easier. So overall, I'd say digitalization has enhanced both the quality and consistency in practice. It allows us to focus more on patient engagement and outcomes rather than the administrative hassles that we had. uh, this helps in making nutrition care much more effective and meaningful. So thank you. Over to you, Prachi.
Yeah. Thank you, Dr. Mansi, for your wonderful keynote. We truly appreciate your time and the valuable perspective you have shared with us. Now let's extend a warm welcome to Dr. Sanjeet Sasidaran, Director of Critical Care at SL Raheja Hospital, Mumbai. Dr. Sanjeet is the co-creator of Clinix iNutriMon, contributing his expertise to develop this innovative and clinical nutrition platform. He is a leading expert in neurotrauma and critical care nutrition. Dr. Sanjeet is the only doctor with a fellowship in neurotrauma critical care from Hadassah University Hospital, Israel, and also holds the European Diploma in Critical Care. He is a past president of ESPEN. He has over 100 publications, authored several books. He is also known for his evidence-based and technology-driven approach. Dr. Sanjeet continues to inspire excellence in intensive care medicine through his teaching and innovation. Let's watch a video message from Dr. Sanjeet sharing his keynote thoughts.
We're always in the search of how technology could impact lives, how could it impact my work. And I think every dietitian, every nutritionist, and every doctor involved in clinical nutrition should actually raise the bar when it comes to technology. And yes, this particular software has definitely raised the bar, and I'm happy to be associated with the same. It empowers clinicians, nutritionists, and performance experts with a smart, integrated system to manage every aspect of patient care. This clinical module will transform practice into a data-driven, patient-centered experience, which would integrate clinical, nutritional, and performance metrics in one intelligent platform. Let's see how this goes ahead, and I'm certain it's going to be great.
Thank you, Dr. Sanjeet, for your insightful and inspiring keynote address. Your words truly set the tone for today's session and gave us much to reflect on. Before the demo, it's important to understand the story behind Clinix iNutriMon, the challenges dietitians face, and how the solution was designed to make a real difference. Let's watch the video.
Every great solution begins with a real problem. For dietitians and healthcare professionals ready to deliver evidence-based care, the daily challenge is clear. Time drain from manual planning, paper chaos in records, and disconnected care. Valuable clinical time is lost in administrative work when it should be spent with your patients. This is where Clinix iNutriMon was born, It's the trusted scientific nutrition platform, now built exclusively for your daily practice. For over 5 years, iNutriMon, endorsed by leading medical bodies with patented software, has powered 25 plus of India's leading hospitals, and now we're bringing that hospital legacy right to your clinic. Our enterprise partners have already seen enhanced patient compliance, accelerated recovery times, and happy dietitians and healthcare professionals. Clinix iNutriMon is your complete clinical nutrition toolkit. We move beyond simply digitizing data. We offer smart solutions, real impact. You can generate instant, evidence-based prescriptions in just 3 minutes. Seamlessly create and share personalized diet plans from a library of 2,500 plus recipes. We even include all the scientific tools you need like NRS 2002, NutriScore, and GLIM criteria. The results are profound. You can reclaim 40 plus minutes per patient for what matters and increase patient throughput by 70% plus without sacrificing quality. Clinix makes it simple. With one-touch reviews and auto-documentation, you have digital, HIPAA-compliant records ready for instant history, progress, and outcomes. This is how we transform patient interactions into lasting nutritional outcomes. You can now demonstrate measurable results that justify your premium positioning and differentiate yourself as an outcomes-focused practitioner. With Clinix, you can manage patients and clients of all sizes, shapes, genders, and disease types, always aligned with the latest clinical guidelines. With Clinix iNutriMon, you don't just advise, you transform lives with systematic, proven nutrition care. Start today. For a limited time, Clinix iNutriMon is free till December 31st, 2025 for the first 500 users. Claim your free premium access and start transforming lives now. Your patients deserve measurable outcomes. Your practice deserves sustainable growth. You deserve iNutriMon Clinix.
So that was the story behind Clinix iNutriMon, where technology meets clinical expertise. Now let's see it in action. Now we are moving to the most exciting part, a live walkthrough of Clinix iNutriMon in action through a real-world case example. Hello everyone, I'm Prachi Villal. Today I'm excited to showcase Clinix iNutriMon, our comprehensive nutrition management platform designed to streamline the entire patient care process. From assessment to personalized diet plans, so dietitians can spend more time with patients and less on paperwork. Meet Mr. X, a 45-year-old male with type 2 diabetes and obesity. His BMI is 31.2. He shows central obesity with 32% body fat and reduced muscle mass. His lab revealed HbA1c 8.2%, fasting glucose 140 mg per dl, and elevated LDL at 160 mg per dl. Clinically, he has long-standing hypertension on medication. Lifestyle-wise, he is a sedentary, has irregular meals, and often snack at late night. Diet recall shows high refined carbs and sugary drinks. Now, let's have a look at how we can create the patient's appointment. Click on Create New, select Doctor, select Date, select Time Slot, add patient name, contact number, email ID, and click on Save. Your appointment saved successfully. Now add body assessment techniques, tricep skin fold, MUSE, hand grip strength, waist circumference, hip circumference and its ratio. Add clinical details that patient has come to us for weight gain treatment. Can create diagnosis as weight gain. Click on Save. Add hypertension as a history, diabetic type 2, write or mark if any allergies. Add diet recall. Let's have a look at SGA. Add nutrient intake if there is any change. Add weight history if there is any weight loss or weight gain. Add symptoms if any. Add functional capacity, metabolic requirement, physical examination such as loss of body fat, muscle mass, presence of edema and ascites. And you can see the SGA score at the left hand side. Click on Next. In Clinix iNutriMon, we have integrated key assessment tools to give a complete patient evaluation. This includes PHQ-9 for depression screening, TAS-21 for stress, anxiety and depression, Montreal Cognitive Assessment for cognitive function, and the New York Heart Association questionnaire for cardiovascular assessment, all seamlessly within the patient profile. Now let's set the calorie, protein and volume goal for the patient. Let's set the calorie. Suppose 18 calorie per kg body weight, 1 gram of protein, full volume. You can add supplement if you want to match up the calories. You can add scoops. You can add time. You can select the diet template. Suppose weight loss diet, category full diet, patient is diabetic. You can see the plan. Just click on the recipes which you want to prescribe for the patient. Those recipes you are clicking, that will be adding up for the prescription. Add instruction template as well. What all instructions you want to give it to your patient. You can also add next follow-up date and confirm. This will be your final prescription, which you can share with your patient. Click on Save. Now, let's have a look at our second case, PCOS and weight management. Miss A, a 27-year-old female with PCOS, is overweight with a BMI of 29 and central adiposity. Labs show elevated fasting insulin, altered LH and FSH ratio, and dyslipidemia. Clinically, she has irregular cycles and mild hirsutism. Lifestyle assessment reveals poor sleep, high stress, minimal activity, and her diet includes skipped meals and late night snacking. Same as previous case, we have created patient appointment and patient profile. Now let's have a look at planning again. We can set the calorie, protein and volume for this patient. Click on Next. Let's focus on diet template. So this is the diet template created for weight loss. In breakfast, if you want to add any other recipe, you can add and click on plus. You have liberty to change or edit the recipe. Mid-morning, if you want to add dry fruit milkshake, you can add. Click on that. For lunch also, you can add your own recipes. Add recipe and click on this checkbox so that recipes will be added in that particular meal time. For tea time, mid-evening also, you can add your own recipe. Or you can change the quantity of standard meal template as per your prescription. You can see all the calorie, protein calculations are there. If you want to write any remark, you can write. Example, no added sugar. Then select instruction template. I have selected guidelines for PCOD. You can add your own template or own guidelines in this. Add next follow-up and this will be your final prescription. Click on Save. Add mobile number and click on Send. This will be your detailed prescription. This includes your entire patient's case summary. Thank you. Now we have noticed how the system automatically calculates BMI, diet requirements, and once the data is in, we can instantly generate a personalized diet plan. Something that used to take 30 minutes can now be done in 5 minutes. What makes clinical iNutriMon empowering is its ability to transform data into decisions, helping dietitians move from manual documentation to meaningful clinical insights that improve patient outcomes. Now, before we move into our panel discussion, let's take a quick look at the latest updates from Clinix iNutriMon. showcasing how it continues to evolve and empower clinical nutrition practice. One of the newest and very useful update in Clinix iNutriMon is the diet recall. It helps dietitian quickly note what a patient eats in a day, meal by meal, and immediately check if their nutrition is balanced. This saves time and makes the assessment and planning much more accurate. We have now enhanced the planning and prescription module with advanced disease-specific customization. The software automatically aligns calorie and protein target based on the selected clinical condition as per the ASPEN and ASPEN guidelines. Users can now select from multiple disease categories, including critical care, liver disease, renal failure, transplant phase, etc. Another exciting update in Clinix iNutriMon is the addition of scientific formulas. This allows dietitian to calculate nutritional requirement along with the deficit calculation. It also suggests scientific formula products instantly, makes planning faster and more precise. Whatever we have seen in the demonstration, that was our current feature. So the screenshot which I have shared with you now, that is our updated version of the Clinix iNutriMon. So now we are moving to our panel discussion. A very warm welcome to our esteemed panelists. We are truly honored to have you with us today. Your expertise, experience, and insights will be invaluable in making this discussion both engaging and informative. We look forward to your perspective on transforming your nutrition practice through digitalization and are excited about the rich conversation that will unfold. Thank you for taking the time to join us and share your knowledge with our audience. Over to you, Chinmay.
Thank you so much, Prachi. Now, I would like to invite our first panelist, Miss Amri, who is a chief dietitian at Kim's Hospital, Thane, with over 15 years of experience in clinical nutrition. She has led nutrition team at Fortis and Brocard Hospital with expertise in clinical care and bariatric nutrition. She has played a key role in quality and accreditation initiatives. She's an active member of IIP in India, and she continues to advance clinical nutrition education and practice nationwide. Welcome, Amreen ma'am. Moving
Thank
on to our next panelist. Uh, let's welcome our next panelist, Ms. Anam. She is a senior officer dietitian at the Head and Neck Cancer Institute of India with over 9 years of experience in oncology and multi-specialty nutrition. She is a certified diabetes, onco, and FODMAP dietitian. Her work has earned multiple national and international awards, and her expertise has been featured in leading media outlets like the Hindustan Times, India Express, and Times of India. Welcome, Anam ma'am. Our next panelist is Miss Aarti. She is a chief dietitian, clinical services at Mom Story Sayadri Super Speciality Hospitals, Pune, with over 18 years of experience across leading hospitals. She is an expert in clinical nutrition and quality management. She serves as a joint secretary of IIP in Pune chapter. She is a certified nutrogenomic counselor and HACCP auditor and has contributed to research and conferences, including co-authoring. Welcome, Aarti ma'am.
Thank you so much, Chinmay.
Now, I would like to invite Ms. Nisha. She is an assistant professor and program coordinator at SVT College of Home Science, SNDT Women's University. She is a registered dietitian with a PhD in biological sciences. She brings over 15 years of experience in clinical, community, and sports nutrition. She has contributed extensively to research and education and continues to inspire innovation in nutrition practice and learning. Welcome, Nisha ma'am. Our theme for this discussion is future skills, evidence, and empowerment. Now that we have seen clinics in action, let's hear from our panels of experts on how this technology redefining the future of clinical nutrition. So let's start with our panel discussion. I would like to ask first question to Amreen ma'am. Can you tell us how important proficiency with digital tools, telehealth, and nutrition technology is in modern practice?
So thank you so much, Chinmay, first of all, for your kind introduction. And the question is really great. So the coming to proficiency with digital tools and telehealth. See, I feel it's no longer an option for clinical dietitians. It's an essential part when it comes to a clinical practice. So these kind of technologies, like iNutriMon and the clinic, what the OPD platform, the dashboard that you've started, it expands our access to care. It improves patient engagement, and it also allows us to deliver more personalized and data-driven nutrition support. We can store in the data, we can access it anytime. In OPD practice, we usually see that when we give a diet chart to a patient, like Zamrud ma'am was saying, we use Word format wherein we just given prints to the patient. We are not sure whether they are going to follow it for a long period of time, or when they come to follow up with us, they're going to carry the same sheet with them. They may misplace it, or they may just keep it in a file and not follow it. So these kind of apps helps us in tracking the nutrition and maintaining the records, and it helps us also to stay connected with the patients. So even patients will become more aware about their progress. They will also be themselves able to monitor what they are following and how they are progressing through the diet. And also they will be able to follow it for a longer period of time rather than just keeping it in the file and just forgetting it. So I think the key is balance. Technology, it should enhance our practice and not replace the human connection. It is always better when we are not able to meet the patients who are immobile. Many a times they are not able to come and visit us in the OPD. They send their relatives. But I think with applications like this, it will be helpful to us to connect with the patients directly, wherein they cannot meet us physically, so that we can counsel them one-on-one. We will be able to address their personal queries, which the relatives or the attendants may forget. So, yes, I think it is very important that we go into this digital sector of nutrition consultation for the patients, and it will definitely help our profession grow rather than just getting replaced by AI and other tools. So, thank you.
Yes. Thank you. Thank you so much, Amreen ma'am. That was great insight. Thank you so much. Moving on to our next question. My next question is for Anam ma'am. Can you walk us through how you handle patient assessment, like from anthropometric or to biochemical data? And do you think that digital tools can make any difference? Hello, Anam ma'am.
Yeah, hello. Am I audible?
Yes. Can I repeat the question? Hello. Hello, Anam ma'am. You are on mute.
Hello.
Yes.
Okay, so in my current practice, as I work in a cancer hospital, so we handle patient assessment through a detailed stepwise approach, like which combine the anthropometric, clinical, dietary, and biochemical evaluations. We begin with the anthropometric measurements such as height, weight, BMI, and mid-upper arm circumference to assess the changes in the body composition, which are very crucial in oncology patients, especially those at risk of malnutrition or muscle wasting due to treatment side effects. We tracked all these data also. And from biochemical side, we carefully review their blood, lab parameters such as serum albumin, hemoglobin, electrolytes, renal and liver profile test. So, however, much of this process is still manual, like data recording, calculation of the calorie, protein intake, and interpretation. It could be time consuming also. So that's where I feel digital tools can make a real difference. Like, for instance, an integrated electronic nutrition record could automatically update weight trends and lab values, also reducing the scope of errors. And digital nutrition assessment tools could analyze meal photos to estimate nutrient intake more accurately. So, digital dashboard can also help visualize changes in nutritional status over the course of chemotherapy or radiation. It also shows improvement in patient monitoring and early detection of malnutrition. Moreover, mobile apps for symptom tracking and like their diet calculation enhance the patient engagement and make follow-ups more efficient, especially for those unable to visit in a OPD basis frequently. So we can say that like in my current approach at the cancer hospital relies heavily on systemic manual assessment. The integration of digital tools can truly elevate care by saving time, improving precision, and providing more personalized, data-driven nutrition support to oncology patient.
Yes, yes, I think you have addressed the great point. Like the apps like Clinix has a really,
Yes.
important
Hmm.
role when it comes to cancer patient, because in these patients, digital tools are very much important. So
Yeah, and
thank you.
when they see the difference also, so it also impact their like yes, we are gaining the weight, our muscle mass is improving, our lab values are improving. So it impact their them also.
True, true. I think it's really a great point. Thank you so much, Anam ma'am.
Most welcome.
Moving forward, my next question is for Aarti ma'am. Can you tell us which features or function you considered must-haves in a clinical nutrition software for it to support your practice?
Of this program. Thank you so much, Hanser. Thank you, Prachi, and thank you, Chinmay, for inviting at this platform. So now, going to the question, what is to be addressed. So while we practice what is more important, we go for something from a patient care to a patient experience. So whether it is an IPD area or an OPD area, what does my patient experience is going to help that patient get back to me, and that is in a way going to help back to kind of help the patient better in terms of the recovery and where the nutrition plays a key role. So when we see the software, I guess it gives an answer to a lot of things. Of course, through the demo also it has been elaborated and it has been demonstrated a lot of things. So one is, the essentials as you already have incorporated, or any kind of tool that we are going to use has to give us an assessment which is updated. Second is, we are having this at the clinic, at the hospital end also. So we handle the OPDs and IPDs. So it has to integrate with the biochemical parameters. So, when has the patient come to me last, or before coming to me, what was the consultation that the patient has consulted? So has he been to a gastroenterologist or an endocrine? What are the investigations that the doctor has prescribed, or what are the previous examinations or the investigations that the patient has come up to me with. So when I just before the patient enters into my room, and if I have a great idea about the anthropometry which my nursing is going to take care, and the biochemical parameters, of course, we can engage the patient, and if we have such platforms, whether the patient is itself able to give a recall. So I have that entire picture clear. And when we see today's practice, people want to be heard. So with this, into a clinic or at the bedside also, we can give a lot of attention to understand the patient beyond the nutrition recall or the diet recall, and the circumstances what make the choices for the patient. So I guess into the software, having a diet recall system which calculates. So the moment I'm entering, I do have a recall and I'm able to indicate the patient. So patient needs guidance and specific guidance. He is not looking forward any of the vague kind of indications. We are able to identify exactly what is the nutrient gap. What is the nutrient that is going to help recover? So what is the nutrient gap? And of course, with these platforms, you are able to visualize them more, and then integrate it into a tailored diet plan to make them understand what are the functional foods, and it helps us give more ideas, which I guess, it's not possible when you do a manual kind of practice or a prescription or any kind of Word, Excel documents that we maintain. So it helps us to maintain the templates better and to personalize them better. Now, while we are doing all of these things, what is more important is what is the deviation, what have we planned and what is the deviation. So that if it can be alarming while the patient comes for a recall, or else, in terms of the IPD patients, or in terms of the patient itself, if they are putting a daily track and if they are alarmed, this is your specific functional food and probably you've not had it. So, not in this meal. So it helps us to plan better also in terms, and so that the patient also feels it is more personalized and individualized. And diet always is rejected because they don't find it practical. I guess with this software you also get to an understanding how can we make the patient more convinced about it. Okay, then again, the essentials of it is again data management. So, one is the clinic side that we see and other is the hospital side which we see, and it helps us into the quality improvement projects also. So like, Dr. Shashidharan also mentioned, and what we are looking forward towards, how does the dietitian stand out? We do a lot of hard work, and what will make us stand out is how do we utilize this data into quality improvement projects. What is the trend of the diet that is going on, and thereby, how do we kind of make those changes into the therapeutic meals also that we plan into the hospital, or what are the generalized guidelines which we'll talk about. Just to quote an example, what is the carbohydrate intake, the glycemic index, the glycemic load. So this, kind of gives us a lot of time with the patient to make them understand and make them convinced. So what the patient carries beyond the prescription is your conviction. And with the ease, with the software that we give, it gives them more confidence that yes, they are, into the right hands and the right guidance. Now, while we are doing it, just one factor that we need to understand is, see, data privacy is something that is very, very important. So, we need to see how is the data that is being maintained. Is it that safe? It should not be going out. And like how we have any incidents in a hospital and we have a root cause analysis to it. So similarly, it's a software. So we need to have those kind of, systems which, if any, glitch into the data or something that needs traceability and we need to diagnose where exactly, it is there. Now, with this, a last point is that, we all have worked in hospitals and we know it's, a lot of we do have non-Indians or we have foreigners coming to us, and that's what the challenge goes with us, that translating it into their own languages or maybe local languages or maybe into their ingredients. So I guess with this software, this eases us a lot in terms of the MNT to be more tailored specifically, not just locally, but beyond the, beyond the national preferences of the diet also. I feel, this is what, and just to conclude, that it has to be cost effective. So from my end, I would say these are the key features that I would look forward, or we would look forward when we are looking into any kind of clinical nutrition software for our practice.
Thank you so much, Aarti ma'am. That was really great insight. I mean, you have covered almost all the pointers which are important when it comes to the patient care. So we will definitely, try to incorporate all the suggestions you have given. Thank you so much. My next question is for Nisha ma'am. Could you please share one key message for the young dietitians who are stepping into increasingly tech-driven practice environment? So we have a very special message from Nisha ma'am.
Hello, everyone. This is for all the young professionals who are beginning their journey into dietetics, where it's a period of rapid transformation. So technology today is not just influencing how we deliver care; it's expanding what's possible. So from your AI-driven dietary analysis, remote monitoring, and telehealth consultations to your personalized nutrition based on genetics and of course microsome data. These innovations are of course reshaping the way we practice. And I'm sure as a new dietitian, you're uniquely positioned to lead this change. Now, if you look at this shift, okay, this transformation, with technology, we see it as an opportunity and not a challenge. Because, of course, if you look at the advantages which technology has, so of course, if you look at health and digital platforms, they let you connect with clients across geographies, removing barriers and increasing access to care. You have a lot of these wearables, you have apps and health data which allow you to track real-time patterns, empowering more personalized, timely interventions. You also have technology which can, of course, help you streamline assessments, your documentation, your follow-up, giving you more time to focus on what really matters, and that is the client relationship, of course. And from app development to content creation, you also have something like digital coaching today. So if you look at technology, it is definitely opening up, a lot of non-traditional, career opportunities today that, of course, did not exist a decade ago. And if you look at these digital tools, okay, they help clients track progress, stay accountable, and of course, become very active participants in their health journey. Now, what should be your role as a nutritionist here? Of course, when it comes to technology, can be the bridge between, of course, cutting edge tools and compassionate evidence based care. And you need to guide your clients through an increasingly digital world with a lot of clarity, empathy, and integrity in general, basically. So you need to stay curious, you need to be critical, you need to, not be afraid of experimenting and innovating. And of course, the future of dietetics, it's not just about food, it's about, data, behavior, you have accessibility, you have design, and of course, with your skills, passion, and adaptability, you are more than ready for it. So I think you should just take it in your stride with a lot of courage and just go ahead and, you know, just use all the opportunities which are available with respect to technology. So all the very best to you all. Thank you so much.
Thank you all for our panelists, Ms. Amreen, Ms. Anam, Aarti ma'am, Nisha ma'am, for sharing such valuable insights. Your perspective truly highlight the opportunities and challenges in shaping the next generation of clinical nutritionists. We have seen the demo and explored the latest updates in Clinix iNutriMon. Now it's time for your question. Please type your questions in the chat box and our team will reach out to you later. Before we conclude, we are delighted to have Dr. Sanjit with us to share his insight and takeaway message from today's session. Welcome, Dr. Sanjit.
Yeah, thank you very much, Prachi, and welcome to all the panelists as well as attendees who are in this meeting, and thank you for calling me in to give my vote of thanks. Um, when I began my journey in nutrition 2 decades ago, our most powerful tools were actually a weighing scale, a food recall chart, and maybe my intuition. But today, all of you dietitians are and doctors, whoever are attending, are stepping into a world where data streams from wearables, indirect calorimeters, apps that can track every bite and breath. But the truth is what? Technology will only ever be as good as the human using it. I mean, without the human using it well, the technology is not going to do well. Don't let data replace your curiosity. Let it deepen it. In fact, don't let algorithms even define your patients. Let them inform you how to see the person behind the data. Use every digital tool from continuous glucose monitors to body composition analysis, not to impress. Don't use it to impress your patients, but to understand. So use the software to understand what's happening. Numbers are the language of metabolism, no doubt about it, but empathy is the language of feeling. So really, the dietitians who will thrive tomorrow aren't the ones who know the most data. They are the ones who can turn data into meaning and meaning into motivation. In short, that's the heart of modern nutrition: precision with purpose, powered by both technology and compassion. And I think this particular software will do it for most of the dietitians in this. I'm glad to have seen something like this, to have been part of creating something like this. It will definitely help us to stay scientifically sharp, digitally fluent, and also never forget that your greatest asset is not an app or an algorithm. It's your ability to listen, translate, and to care. Thank you very much, Prachi, for having invited me for this.
Thank you, Dr. Sanjit, for sharing such meaningful insight that will inspire all of us in our practice. We sincerely appreciate your time and expertise. Aarti ma'am, could you please share a few thoughts as a take-home message?
So Thank you, Prachi. And already Dr. Sanjeet has explained it so well. And what more can I add to it? But then it's really great with his leadership and entire of his experience coming together with such a great tool is really an advantage to all of us as practicing dietitians. And I think we should take maximum use. I truly agree with Sir that it's not just the human skills or the technology. Effectively utilizing the technology for the human skills, so it is more effective wherein it is going to give a more personalized and more human touch to the patient care and experience that we look forward, and that's what the generation now we are into a zone where there are different generations and nobody has time to wait. And with this tool I feel it is more precise wherein it is just analyzing, it is precision also, and you have a real time kind of diet chart that flows in. The kind of load, whether it is clinic or OPD, is quite high, so either the dietitians use template which are not that personalized. I feel here is where the role of such nutrition apps or the technology comes, the software comes, wherein with the limited time you are still effectively utilizing your skills and giving a more precise data to make a difference into the patient. That is going to take a major kind of thing. And I feel when the diet charts used to go, they used to be very monotonous. It would be do's, don'ts, and the functional foods. But with this I think it is more demonstrative. With the technology you can actually demonstrate the portion sizes, the visual appearances, and I think we should look forward towards recreating our discharge diet plans to be more more informative and more engaging towards the patient, I feel. And it has been great with the entire session, the ways the software has come, and we really are excited to kind of utilize it further and make a difference in the patient care and patient experience. Thank you.
Thank you. Thank you, Aarti ma'am, for your time and expertise and your insights on this. So, as we conclude today's session, I would like to sincerely thank all our speakers, panelists, participants for their time and valuable insights. I hope the discussions, case demonstration, and shared experiences have provided practical ideas that you can implement in your daily practice to enhance patient care. Let's continue to embrace innovation, digital tools to make nutrition management more efficient, personalized, and impactful. Wishing you all continued success in your work, and I look forward to seeing the positive changes we can create together in clinical nutrition. Thank you. Over to you, Rona.
Yeah, thank you, Prachi. As we close today's launch, let's just take a moment to reflect on what this journey truly means. That Clinix isn't just a new platform, it's a beginning of a movement that's been designed to bring purpose, precision, and compassion back into every patient interaction that you would have. Because far too long, nutrition care has only been about managing data and juggling systems. But with Clinix, we're reimagining that. We're trying to turn information into insight and insight into a measurable outcome. Because at the end of the day, your patients don't just need advice, they need transformation. Your patients don't need tools. Your practice doesn't need tools. It deserves growth. And you, the professionals that shape the future, you deserve clinics. So as we step into this new chapter together, let's redefine what's possible in clinical nutrition. Let's make care smarter, outcomes stronger, and an everlasting impact. Your journey with Clinix iNutriMon begins today. You can register by scanning the QR code or visiting the website, and the user would be free till 31st December 2025 for our first 500 users. Let's create this change together. Thank you.